Welcome, everyone. Good morning. Welcome, welcome, welcome. We have folks coming through cyberspace to the waiting room. Hi, Mark. Hi, Donna.
Good
Hi,
morning.
Kristen. Welcome, everyone. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. It's lovely to see all of you. We're really excited to get started here today with our virtual road tour stop on veteran oral health in Connecticut. I see lots of folks have their camera on. That's wonderful. I invite you, if you haven't already, to turn your camera on and join us here today. This is designed to be a very interactive session. So join us if you're able with your camera and get ready to kind of react and share your thoughts on veteran oral health. We're thrilled that you're here with us here today as we talk about what veteran oral health looks like, both at the national level and then specifically in your state, Connecticut. So without further ado, I'm going to get us started and talk about what we're going to walk through here today. Okay, so as I said, I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. You'll see Shayla Stewart here on our call. She is here from AIDPH as well. If you have any questions, you can pop those into the chat, whether it be about the presentation or if you're having any Zoom issues, and Shayla can assist. She's going to be helping us with our polls and our reactions and monitoring the chat as we're here today. So I'm going to give us an introduction. I'm going to go over some housekeeping pieces right now. I'm going to talk about who we are as AIDPH and why we're here with this data, how we got here. We're going to look at veteran oral health at a national level. And then, like I said, dive deeper into what the data looks like in your state specifically. Again, this is designed to be a really interactive session. So we have some different points of posting some things in the chat, sharing thoughts on polls, and some discussion questions. We will, of course, have time for Q&A and discussion at the end as well. And then we'll talk about some next steps and how you can take action on the data that we're talking about here today. Some housekeeping pieces, I already touched on some of these. This session is being recorded. Our slides, our recording, any resources that are shared in this session here today will be posted to our Academy afterwards. That is also where you are able to get your CEUs after this session. Please take a moment and introduce yourself in the chat. We would love for you to share your name, your email, your organization. Not only is this meant to be interactive, but it's meant to be a moment where you can meet the stakeholders in your state who are either working with or interested in veteran oral health. We would love for you to share the work that you're doing in that area and make connections. So please feel free to share that information in the chat and connect with your peers throughout our time here today. It is meant to be a connective point for you and your dental public health community. So part of the way that we're going to use engagement today is using Slido. Slido, if you're not familiar with it, is a platform where we can gather people's thoughts and see people's reactions in real time. We're going to use this for some different polls and reactions throughout. So please take a moment. Shayla is going to pop the link in the chat here. You can simply go to slido.com and type in the number that is shared here, or you can scan this QR code with your phone and pull that up so you have it. I'm going to give folks a second to do that because we're going to be using this throughout our time here today. And again, if we get to it and you somehow closed it or weren't able to get to it, just let us know and we can pop that information in the chat for you. So let's take a look at our learning objectives. These are our learning objectives that are tied again to our CEUs here today. It encompasses what we'll be learning. They're also available in the registration materials, and we're going to pop them in the chat for your reference. But taking a look, we're going to, again, look at some of that state-specific data and really analyze what's happening in Connecticut. We're going to evaluate some policies and how we can advocate for reform to bridge the gaps in veteran oral health. Collaborate. Again, this is a moment for you to see and meet your local stakeholders and make some connections locally. And we're going to talk through evidence-based strategies, again, for kind of addressing these population needs and seeing what we can do to solve some of the disparities that we're talking about here today. So we're going to get started with a warm up on our interaction piece and using Slido. So again, you can click to that link that's in the chat, use that number, that QR code. We want to, if you can toggle over it to now, we just want to take a start in here. What brought you to today's session? Are you here to learn, to share, connect, act, or perhaps all four of those? It's just a quick warm up, and this will also help us make sure that we are talking specifically to what you want to do here today. All of the above, 29%, learning, 75%. Love to see it. All of the above, 33%. Okay. So really looking at all of those pieces, but learning is the main piece. So I'm thrilled about that. I'm excited to share our resources and tools and also answer questions and let folks know that if there are other pieces that come to mind after this session, we're here as a resource and to answer questions. Okay. I am sharing that we do not have any disclosures to share today. I introduced myself. I said, say hello to Shayla. She's here from our staff. We want to say a big thank you to Gary Turco, who was able to help us coordinate this session here today, the Executive Director of Connecticut Oral Health Initiative. Thank you so much for helping us get the word out about this session and connecting with your community so we could have this community discussion here today. Okay, we're going to go back to Slido again. And before we really dive into that data, we want to know, what do you believe are the top priority areas for veteran oral health in your state? And this is going to help us tailor our content here today. So we're looking at access to care, oral health literacy, workforce development, policy advocacy, integration with general health care. And if there are pieces outside of this list, please feel free to pop those in the chat as well. Policy advocacy, we're definitely going to talk about that. Access to care, we are definitely going to cover that. Integration, I love a good integration conversation. Oral health literacy, we're certainly going to talk about some education opportunities we have after looking at this data. Okay, that's great responses. Okay. And I'm going to toggle back to our slides here now, but you can take a second if you have not already responded and respond to that piece there. Okay. So to get us started, again, I'm going to give just a little bit of background on who we are as AIDPH and why we're doing this work, right? So we're a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. When we talk about our community, who is that? It's you. It's dental public health professionals. We're really looking to leverage our work to empower the dental public health community to go out and advance oral health. We do this, we have a research and impact team. The data that we're talking about today, it comes directly from them. Our research is always done in a community engaged model, and our research informs our education and advocacy activities, which we're doing here today. We're taking the data and we're bringing it out into an educational program. I also hope that you'll see that we always strive to take our data and build that into really usable tools and employ translational science. We never want our data just sitting on the shelf. We are doing it so that our community can leverage that evidence in the work that they're doing. We do all of this because we have a vision of a justice-oriented oral health system, and we want to increase equity. At AIDPH, we have 4 communities of focus. That includes LGBTQIA+ people, veterans, which is what we're specifically here talking about today, people with disabilities, and people in rural communities. And of course, we understand that there's intersectionality on these 4 communities of focus. And looking at what we're talking about here today, specifically, we can look and see that approximately 30% of veterans report having a disability, and approximately 25% of veterans live in rural areas, something that we're going to dive into even more deeply as we go through the data that we're talking about here today. And of course, our communities of focus have the common experience of historical exclusion and marginalization from healthcare systems, which is why we're looking at those disparities and those data gaps. I want to take a moment before we dive in and thank our funder for this. I'll talk in a second here that we've partnered long-term with CareQuest on our research on veteran oral health, and they are also funding this project for us to bring out these tools to folks at the local level. So a big thank you to CareQuest. And just taking a quick look, this is kind of showing how we got started and where we have gone with our research on veteran oral health. It started with us coming to a shared understanding with CareQuest that we really didn't know a lot about veteran oral health. There wasn't the data out there. And so that we knew that we needed to do some research and do some analysis. And that really kicked off and led to several different research initiatives, several different publications, many advocacy efforts, and where we're here today, doing this virtual road tour, continuing to do additional research projects, and we're headed in partnership with Open to do a Hill Day in early May. We'll talk about that a little bit more as well. Okay. So we're going to start with a national overview, and this might be familiar to some of you, but we found that many people, sometimes even including veterans themselves, aren't fully aware of how VA medical and dental benefits actually work. So doing this work for many years now, and I will also just share personally, this work is incredibly important to me professionally. I also just happen to be the spouse of a military service member. And so that, of course, doesn't make me necessarily an expert or a monolith when it comes to veteran populations or folks in the military, but I have a personal connection to this work as well. And these communities are communities I've worked with personally over many years now. So again, being deeply ingrained in this work, we've repeatedly found that many people don't understand the eligibility process, what care veterans can receive, or even where and how they can access that care. And that's why we like to begin with setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So here's the key point. Eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined through Congress, through federal law called Title 38, and that outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change like expanding dental coverage requires congressional action. So it's not just a policy or a rule update, it involves passing new legislation and securing federal funding to support that legislation. So when we talk about limits and access to dental care for veterans through the VA, it all ties back to laws at that federal level. So it's just setting the stage, and I also want to point out that that doesn't mean we can't take action and impact change at the local and state level. It takes getting educated like we're doing here today and collaboration with our local communities to look at ways we can solve these problems. Diving into this a little bit more and kind of that understanding of that eligibility piece, currently most veterans are not eligible for dental care through the VA. So if you look at this graphic of people across your screens you see here, this represents about the 20 million veterans living in the US today. The lighter colored half shows the veterans who are either receive care outside of the VA or aren't eligible for VA health care at all. And as you move to the left on that chart, I hope it's your left and not mirroring, but as we look at the darker colored blue colors, that represents the nearly 10 million veterans enrolled in VA healthcare. Of that 10 million, only a tiny fraction, the very small dark blue and red segment at the very left-hand side, is actually eligible for dental care through the VA. So what that means in practice is that veterans might go to the VA for a medical appointment, get treatment for a chronic condition, but they could potentially be leaving still dealing with untreated dental pain because they're not eligible for dental care through there. Additionally, even among that about 1.5 million of veterans who are eligible for dental benefits, only about a third of them are actually using those benefits. We need more information there to kind of fully understand in an evidence-based way why that is, but we can make some educated guesses and understand that barriers to care, lack of awareness can play a big role in that utilization piece. So We're left with a deeply inequitable system. Veterans either aren't eligible at all or face a fragmented health landscape that makes it hard to get consistent, high-quality care. And taking kind of a look at that, the problem is even worse for veterans living with chronic conditions where good oral health is especially critical. So we're going to take a look at that chronic disease connection piece here. Veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. I think many of us here are probably familiar with this. And what's more concerning is that veterans with these high-risk, high-cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non-veterans, even if they've seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting dental care, many still face some of the worst oral health outcomes. So a big reason for that is a lack of an integrated care system. The chronic conditions aren't being addressed in coordination with the oral health needs. And we understand that the VA is the largest integrated healthcare system in the country. It's uniquely positioned to manage complex care for veterans with multiple chronic conditions. So when veterans with those chronic conditions are able to access the dental care, they're in a better care environment when it's integrated. But since most of them aren't eligible for dental care through the VA, they're missing out on that critical coordinated care. So diving into that a little bit more, this is some recent research from AIDPH that we conducted in partnership with CareQuest, really focusing on the connection between chronic disease and oral health. So again, this might be very familiar to some of you here. Even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes are still 40% more likely to be edentulous, meaning they have lost all of their natural teeth, compared to veterans without diabetes. That's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. And we see that similarly when we look at heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. And that's reinforcing what we're seeing across the board. Chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. And so let's take a look at what that looks like from a systems perspective. We want to highlight that this isn't just about poor oral health outcomes and reduced quality of life, though of course those are incredibly serious concerns, but it's also about the broader health impact and the cost of care. When dental care is managed as part of an integrated healthcare system, like what the VA could do if dental coverage were expanded, there's a clear opportunity for cost savings, especially when veterans with chronic disease. Some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a dollar savings in related medical costs. And with heart disease, it's more striking. For every $1 spent in preventative oral health care can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's paying for itself. And that's important context to keep in mind as we look at chronic disease conditions and trends in Connecticut and consider what solutions we might look at for your state. Okay. So these are some data points collected from research that we've done with CareQuest. I mentioned earlier kind of that rurality piece and how that disproportionately affects veterans. So we're going to dive into that a little bit more here. These data come from BRFIS, which is a national survey of veterans administered in 2021, and from data assessed through the VA. So taking a look at these numbers here, we see that rural veterans are more likely to rate their dental health as poor compared to urban veterans. So again, we're looking at rural versus urban veteran here. We see that 72% of rural veterans are seen in private practice versus 64% of urban veterans. More rural veterans visited an emergency department for dental issues, and more rural veterans did not qualify for dental through the VA compared to urban veterans. So how can we look at this data a little bit more? So the pieces that we're talking about here today, when we go into your state profile and the research that I'm talking about, that is all available on vetdentaldata.org. dashboard. And it's not just standing publications that are there. You can explore more insights through our interactive data dashboard that we have there. The dashboard includes a range of indicators related specifically to rural veterans, cost of care, and state-based data. We've dedicated an entire tab, which you can see. So if you toggle over to vetdentaldata.org, you'll see this piece right here where that red arrow is pointing. And while state level data from MEPS or military entrance processing stations aren't available, the dashboard does have regional level data. And that means you can still get a useful proxy for understanding trends in specific state or areas. Let's look at this a little bit more about what we can see. When you click on the rural tab in the dashboard, you'll be taken to a dedicated section focused on rural veterans. The data is interactive and easy to navigate. Across each indicator, the trends are clear. Rural veterans are more likely to delay dental care because of cost. They spend more out of pocket, and they often face challenges finding accessible dental care in their communities. I think we understand that across populations, right? That finding those care providers in rural communities can be hard. This isn't a comparison to general populations, just pointing that out. It's rural veterans compared to all veterans, and you can explore all of this data directly on the dashboard and toggle through and see what's applicable to your community. So rural veterans also report feeling a deeper impact from limited access to dental care. Many share that they feel embarrassed about the condition of their mouth or teeth, more so than their non-rural peers. And they're more likely to struggle with maintaining functional dentition, which likely contributes to higher costs of care and increased use of the emergency department, which we saw on that previous slide. Okay. So again, where's all of this information coming from? It is all on vet dental data. What you're seeing here is just a snapshot of the research and the tools that we've developed to help organizations like the ones that you all are working at. Again, the goal here is to have access to clear, tangible data for veterans. And this information can be really tough to find, and that's why we've worked with CareQuest closely, and veteran partners. Again, our research is always community informed, and pulled in every available data point we could find. So from the VA, from national surveillance systems, more, again, independent research on the qualitative side. We've brought it all together in one place to make it easier for you to take the information and apply it to your work. And so we're going to kind of, again, dive into some of those pieces at the state level and really looking at what we can do. So taking a quick moment and understanding why we're doing this tour. If you go to Vet Dental Data, you can hover over Connecticut on the interactive map. It's where you'll find your detailed profile. We've created them for all 50 states to provide specific relevant information. And we just really want to make sure that you can explore the data in a way that's meaningful to you and that you can focus on the issues that are relevant to your community. Okay. So we are going to dive into Connecticut and look at that data that I've been promising the whole time. But first, we want to toggle back to Slido. Before we look at what your state looks like, we would love to hear from you about what you think your state's biggest challenge is for veteran oral health. I am going to toggle over and see what all of you are saying. And just type in a word or phrase that you think is the biggest challenge. Access. Transportation. Affordability. Providers. And of course, we see the connective tissue between these pieces as well, right? With the transportation, affordability, providers, those all are part of the bigger access piece. Understanding what is available, insurance coverage, and providers who take it. The knowledge and understanding piece is a big piece. We're going to talk about that a little bit as we go through how we can leverage trauma-informed. Yes, absolutely. That's really something that comes up over and over again in these conversations.
Liz
Okay.
Welch posted
Yes.
in the chat. Another challenge is information on what is actually available.
Perfect. Yeah. Um, that education piece is seen over and over again. We're going to talk about some of those pieces. And if anyone is doing anything in that area, please share it in the chat as well. Okay, this was great. Thank you for participating. All right. Okay. So you probably have already pulled up your state profile, but if you haven't, I invite you to do so that you can follow along and take a look um, at your profile as we walk through. And I just want to point out that this road tour is just as much about us listening and learning from you. You know Connecticut best, your data, your context, your communities. Your insights help us improve these profiles and make sure the tools we're providing are actually useful in your efforts to support veteran oral health. We'll have some opportunity for you to let us know what you need so we can make sure that we're aligning our work with what our community needs. We've done our best with the data available, and while it's limited, these profiles aim to offer clear, visual, easy to use information that can support conversations and decisions across different audiences. So let's take a look. Okay. So we are looking at your profile here. We start at the top of the state profile. We open each profile with some quick context, what's happening in Connecticut and how it fits into the bigger picture nationally, especially when it comes to dental care across, dental care access through the VA. And again, the key point that we always include is that most veterans are not eligible for dental care through the VA. That's something that many people, especially policymakers, funders, and decision makers, don't realize. We've been saying this for years now, and I always doubt myself a little bit, kind of hammering home this point. Many of you may have just been at NOHC. We were there with our booth. This was actually our trivia question. And I was like, oh gosh, people have been hearing this from us for how long? But even some of our partners and people who work with us closely were unsure of which percentage to put in there. So I will take that as my clarion call to keep hammering this point home and really share out that most folks are not available for dental through the VA. It's a very low percentage. So when you're starting the conversation, it's a powerful place to begin, sharing with the folks that you're talking to, especially if they are not in the oral health space, that veterans often don't have an option for dental care. And because of that gap at the federal level, it's states and local healthcare systems that end up carrying the weight. So whether it's disease burden, access issues, care delivery challenges, that's falling to the states. And that's, again, why we're hoping that these resources can help you in the initiatives that you're doing to access those, address those challenges. So we've also included data on where veterans in Connecticut live, especially counties with high concentrations, and we pulled in whatever we could find on rural veterans. So veterans are more likely to live in rural areas. We just dove into that pretty deeply. And we know that rural communities already face higher barriers. So you can kind of see down here in green those counties that have the highest veteran populations. If you look at that in comparison with other maps, like where VA dental clinics are, that can kind of really start to give a systematic insight on how and where to get started. Okay, so let's look at the other parts. Let's look at some state-specific insights. Okay. Here we've compared Connecticut to national averages because without that context, numbers don't mean much, right? So if you're sharing this with a policymaker, a veteran group, a program leader, they might not know if 17% is high, low, somewhere in between. And that's why we've included national average to help you quickly see where Connecticut stands. And you can also compare across states if that's helpful. Again, these profiles are available for all 50 states. So if you have a neighboring state or a state that has similar challenges, you can pull up and kind of look where they are and kind of, again, give you a little bit more of that environmental scan. So earlier, I mentioned chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. Because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking with decision makers or planning programs. So this section, you'll find data on heart disease, diabetes, insurance status, and indentulism, all compared to national figures. We also ranked each state across those 4 key outcomes. So you'll see where Connecticut falls compared to all 50 states. And just a heads up in these rankings, number 1 means the worst. And so if we kind of look here, it actually, that uninsured heart disease piece or the better pieces, diabetes and indentulism, a little more on the lower end. Okay. So then we get to the grade portion of the profiles. We see the grades individually given for diabetes, rates of uninsured, and dental visits. And the percentage of veterans in Connecticut that visited dentists in the past year, and those combined for an overall grade. So we see here that you're doing pretty well. That's exciting. I would give that as a call to your state to what can you share out? How can you pull out those best practices? And also let us know what success stories have led to these grades that we can share out with other states, because we do get that question over and over again. What are other states doing that make them successful that we can take lessons learned from those? I will also point out that when we see a report card for folks who do maybe have a lower grade or there's a place for improvement there, if you wanted to do some work in diabetes, it's not our first thought, but I encourage you to take a look at where you have an outstanding grade and are doing well, and look at the success stories, the models, the tactics that were taken there. What strategies can you pull from that area that's doing well that might be applicable to where there needs to be improvement done? So again, Connecticut is in pretty great shape, but there is always room for improvement. There also may be lessons learned that can pull out to other populations that are facing disparities. And again, pulling out those models and those success stories to share with colleagues in other states that may be pursuing a greater improvement gap. We would love to hear those. Okay, taking a look at one more part of the dashboard here. So I want to highlight it. I know we've talked about it a bit, but take a look at it and just say that the dashboard allows you to gain quick insights on key indicators compared to other states. So again, you can pull up the profiles and look at them, but this part of the dashboard, while it's using the same data, it's just another way to look at it and really gives you the opportunity to quickly gather comparable data, easy, fast visual comparison of your state and others in regards to veteran dental indicators, and kind of get that really quick visual view. So you've been hearing from me a lot. We're going to pause and give you a chance to share out. So again, this information is based on publicly available data. And so we know that that's not representative of necessarily every single thing going on in the environment. So I would love it if you're able to take a moment and share in the chat if there is a barrier that isn't in the data, but that you know is real for the veterans in your community. What are you seeing in your work that's not necessarily reflected in the data that we've shared here so far? And I'm going to stop sharing for a quick second. And take a look and see what folks are posting in the chat. And I would also say, convenient hours, Kristen is saying. If y'all want to do a quick show of hands too, who is currently working in veteran oral health? And if you're not, that's absolutely just fine. It's very important that we have this conversation with everyone. But are there folks who are currently working in veteran oral health? You could just raise your hand or your virtual hand if you want and kind of see who's working directly with our population. Okay, I take that to mean that none of us are working directly in veteran oral health, but we all have a vested interest in understanding this population and making sure we're serving the need. Okay, if there are other disparities and barriers that you think are a problem, please continue to share those in the chat as we go ahead and move through our next pieces. Okay. Okay, so we've talked a lot about the data and what things look like for your state. I hope going through those details was informative, but really what I want you to take away from this session is next steps and how you can leverage this as a tool in your work. So we can use the data to illustrate the need, we can share the profile and start conversations, we can take action and elevate success stories. Right, which again, Connecticut's doing really well in a lot of these areas. So this is an opportunity to pull that across other work and across other oral health pieces. So we're going to talk a little bit now here in deeper detail about veteran advocacy, how we can educate stakeholders, can leverage the data for decision making and what we're focusing on, as well as seeking funding and using this in our reporting. So talking a little bit more in a deeper way about veteran advocacy, one of the most powerful things that we can do with data is to advocate. And that can look different depending on your role. Maybe you're a provider, a policymaker, a veteran yourself. This profile gives you credible local data to bring to your city council, state legislators, or your congressional representatives. You can also organize a listening session in your community and invite decision makers to hear veterans speak for themselves. Again, raising that community member voice. And also remember that small advocacy actions like calling an elected official or submitting a public comment can ripple outward in big ways. I think that this is relevant to some things that I was seeing folks in their responses in the chat and in your Slido responses. Many people working in healthcare or veteran services don't know how stark the oral health gap is, and for other populations as well. And that's where education can come in. So I know we talked about oral health literacy, and so maybe we need to understand that oral health literacy is a need, and we can really take the profile to lead a short talk at your organizations. Maybe you start with your staff, your colleagues, sharing it out with your peers and colleagues as a start before you go into the broader community or those bigger decision makers. You can brief a coalition, a partner organization, etc. We really believe that when stakeholders are informed, they become allies. That's part of why we're doing here today, is to activate everyone and help them feel connected to veteran oral health. That's how we build momentum. It's also an opportunity to collaborate across silos. Another piece that we always advocate for is making those non-traditional partnerships. So maybe you bring this to someone in housing or mental health or food access and find a new way to align your efforts. So informing strategic decisions, I think this really resonates. Again, I'm not in your state doing your work, but looking at your profile and understanding that there are some successes, this really, I think, resonates for me. Taking a look at that data for strategic thinking, whether you're leading a nonprofit, managing a health program, or advising policy, you can take the profile and help you decide where to focus. Again, looking at that location data, we can understand where that need is, looking whether it's rurality with no dental providers, a population group at a higher risk, etc. And it helps you make the case for why you're investing resources where you are. So if you're doing evaluation or reporting and it gives a baseline, here's where we started and here's where we're trying to shift. And again, this could be applicable to other programs with those success story pieces, right? It's not just taking the number and always needing to improve, but what have we done well and how do we look where we are here? So let's use the same strategy in this other area that needs improvement. It can can build that case in that manner as well. So in that same vein, talking about how this profile can bring in resources, a really similar idea here. Grant makers and funders, they want to see data and they want to see it grounded in the community. So our state profiles really give that. You can use it in a problem statement to show gaps in care. You can cite it as a foundation for the solution. Again, looking at those objectives and those baseline numbers and measurements, you can look at what initiatives have been going on in the state that have led to that success and how we can kind of copy those models. So we would love to hear from you. Taking a look at of these 4 ways to use the profile: education, stakeholders, decision-making for grants, reporting, what feels most viable to you in your current role and organization? And y'all can just come off mute and share. Oh, I'm also looking, there were some pieces in the chat here. Most Connecticut veterans have insurance. Many don't have private insurance, but don't qualify for Medicaid. And the out-of-pocket cost is high for many needed procedures. The Connecticut Mission of Mercy, a free weekend dental clinic, many attendees are veterans. That's good to know. Okay. And am I pronouncing your name correctly? Arnaz, grant writing and advocacy, meaningful and effective communication. That's fantastic. Thank you. And Arnaz is also showing that, sharing that insurance plays a big role in accessibility and that most insurance providers have limited coverage. Okay. All right. Anyone else have a specific way that they're going to use the profile?
I'll just say, Liz, I'm in the process of writing a grant now to get funding to do some free direct services for veterans. And a lot of it will probably be focused on preventative oral health. So yeah, the profile will help me be able to explain a little bit in the grant writing what Connecticut, faces, what areas we're doing well, but what areas we could improve, and how the preventative oral health will save money for the whole healthcare system and help with those individuals with those chronic diseases as well, diabetes, heart disease, stuff like that. So I think that will be very helpful.
Fantastic. Well, good luck with that. I know grant writing season can always be a slog, but I'm glad that that's helpful, and I'm excited to see the outcomes of that for you. So thank you for sharing, Gary. Okay, let's toggle back. Okay, we are also going to do a poll here and hear from you. I mentioned this earlier, but we want to be leveraging these tools in our research to best serve the work that you are doing. So we would love to hear from you about what additional tools would be most helpful to your work. So we have a list here. If you toggle back to Slido, and respond to the poll here. We have education materials, policy briefs, research findings. If there's a tool or a resource that you think you need that's not listed here, post that in the chat, because again, this isn't just so we can keep you occupied during this presentation while you're getting a CEU. This really informs the work that we do. Again, you are the community that we serve as dental public health professionals, and we want our materials to be tailored to your needs. So this is really helpful in us understanding what our next steps are. So I'm seeing policy briefs. We were speaking with Nevada yesterday, and policy briefs was also the main piece. We're going to talk here in a second about some state legislative policy examples that are good to look to, that will be helpful in that. Okay. Y'all can continue to respond as we head back to the slides. We'll leave that open. And that was a great lead in on the policy briefs. So again, there are some policy advocacy spotlights and success stories from 3 states that we just want to take a second and highlight and encourage, if that's an area that you're working on, to take a deeper look at these and consider these approaches. So Florida passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. This program is designed to provide dental care to veterans living in Florida. The department will partner with a statewide direct support organization to administer the program, and that organization will distribute grants to nonprofits with a strong track record of serving veterans. So those nonprofits will deliver care to eligible veterans based on income, service history, and other qualifying criteria. And this is new legislation that's just being implemented. I think in the past month, I would have to double check that timeline, but like very, very newly implemented. So we should keep an eye out on Florida and see how it's working. It's an innovative approach. I mentioned at the beginning, we have this federal legislative piece that dictates eligibility. But there are really creative ways that we can increase access to care at the state and local levels that are innovative and outside of that traditional pathway. So I'm excited about this piece in Florida. Again, I think it's something that really fit the Florida environment and the political environment they have there. So I'm excited to see how that shakes out. Oregon is another state that has some innovative pieces. They developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. Veterans are first screened to determine if they qualify for either. And if they're not, they're enrolled in a local coordinated care organization and receive free dental care through that CCO. A network of community clinics participating in the program. So it's another approach to kind of bringing folks together to provide alternative options. In Iowa, the state uses lottery dollars to fund the Veterans Trust Fund, and that fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. Maine is another state that has a fund of sorts that provides out grants as a bit of a smaller program, but another option to look at. I think that they're working on expanding that. So again, if you're looking at a population that needs to be served in your community, these are 3 different approaches across 3 states that are very different politically, and how they were able to bring innovative programs to serve these populations that worked for their state and their stakeholders in that state. That being said, I want to take a minute and talk about how a project that went more in depth on veteran oral health in a state. So we've had the honor and the opportunity to work with Iowa at very deep level for several years now. We did a comprehensive deep dive report in Iowa and have been doing additional community work there with them since then. So I just want to highlight that if it's veteran oral health or there is a population needing a deeper dive of oral health, this is what it could look like in your state. So we started again with a comprehensive research report. Our research team did an analysis over the course of about a year, published a report that I think is about 75 pages long, very comprehensive, looking at the state and making strategic recommendations. From there, we were able to take that information and those strategic recommendations and bring it out to the community and hear their reactions and what they felt was the most viable. We did that through a series of virtual community forums, and then we ended with an in-person summit on veteran oral health last summer in Iowa. From there, we were really able to do a deep working session with the stakeholders in person, get their reactions to the strategic recommendations that had been made, and understand what was most viable for the state and the stakeholders and the resources they have to move forward on. And from there, we're currently working on taking those insights and developing it out into a strategic plan. So stakeholders in Iowa have a very strategic, data-informed plan specific to the resources and people that they have in their state that they can take action on to actually move forward on these improvement plans to increase veteran oral health access. And again, they already have a fairly innovative approach with their Veteran Trust Fund and leveraging that as a big resource. If you're interested in that and again want like a lessons learned piece, this is some strategic recommendations that we made. You can see that we highlight that Veterans Trust Fund and suggest expanding it, etc. Okay, so that being said, I'm gonna stop my screen again and see if there are any questions we can answer for folks.
So Liz, I'm from Connecticut Department of Veterans Affairs. We heard a couple years ago at the national level that the federal VA was going to bring on, it was maybe going to be in addition to the PAC Act, they were going to maybe get with Congress and realizing it would be billions of dollars, but provide dental care to everybody that was eligible for VA health care. Have you heard anything recent about that initiative?
Yeah, so yes and no. So obviously the full expansion wasn't a part of the PACT Act. We did see a periphery increase because of the PACT Act. So as folks may or may not know, eligibility for dental care through the VA, there's a few different pathways for that. One of the main pathways is your disability rating. And it's required to have 100% disability rating to have dental benefits. There's again a few other pieces. I'm boiling it down, but that's the main way that you can have access to dental coverage through the VA. Because the PACT Act, increased the amount of folks. They changed kind of that disability rating piece, and we saw 100% disability ratings increase across the board. That in turn increased the amount of veterans that were eligible for dental through the VA. So those numbers that we talked about at the beginning, that's actually has increased. I don't know the exact percent, but a fair amount over the past year. That's an increased number. That was a consequence, kind of a side consequence of the VA. So not a direct expansion. We would have loved to see that, Ron. I also think, I mentioned we are going to open Hill Day in May. We'll be in DC. We'll share a little bit more. There are some in-person registration has closed for that, but there's some virtual activation opportunities there. So, we've been talking through what that ask is. There's a few different bills that have floated around about expansion, whether it be pilot programs for those with chronic disease, and hopefully we would get the numbers from those that would make the case for total expansion, right? I'm not sure that I am not a policy expert, but I am not sure how viable those are in the current political environment. So I think what we're talking about is staying steady, keeping the eligibility that we have, and sharing the information out that this is a vital need, and not having the dental care is not only leads to poor outcomes, and we shouldn't be doing that from a humanity level, but it has a health system impact on those cost pieces. The link that I will share will have a link to the training that we will be doing on the specific asks for that Hill Day that might shed some insight into what's currently floating around. So that was a very roundabout answer. I don't know if that gives you a little more clarity or just brings greater confusion, Ron.
No, I appreciate that. I don't want to take a lot of everybody else's time. One other quick one.
Yeah.
Is there a state that you've seen that has done a lot of teaming with universities that have dental programs and dental programs that are providing free care or have memorandums of agreement or understandings with those academic institutions that we might be able to, talk to a state that we're doing a little bit of that with University of Connecticut.
Yeah.
we may be expanding a little bit more.
Yeah, that's a great question. And that's always part of our conversation. It's a big part of the conversation we've been having with Iowa of pulling in the dental schools, the hygiene schools, those associations, and pulling in that piece. And there's a different level of engagement on that across the states. I can't answer off the top of my head which state is doing it best, but Annalise might have an answer to that. So let me check on that and follow up with you if that's okay.
Thank you.
Yeah. What else can we answer?
Liz, good morning, and thank
Good
you for
morning.
this seminar. It's been great. Just a quick question. Are you aware of how many veterans take advantage of the reduced cost dental plans that the VA does offer, that if you're eligible for VA healthcare, but not the dental side, you could buy into those low cost dental insurance plans? Do veterans take advantage of that? Are they helpful? Just wondering if you have any feedback on that.
Yeah, and the answer is I wish we did, but we don't. We don't have insight into that data. It's not publicly available. We get similar questions with veterans using Medicaid, and so to that we say we wish we did, and we say as oral health stakeholders to push for that data availability and kind of some greater surveillance around those pieces so we can have greater insight. When we talked about that utilization piece, both for folks who are eligible and not using, or folks who aren't eligible, we need more data on that utilization side. So I think that there's some surveillance and systems level pieces there, but then also the other piece that we hear from folks at the local level and double tap on for folks is what can we do with private practice or people in our stakeholder groups to understand who's serving those veterans? And often we find that people who are in private practice, sometimes even FQHCs, they don't know that they're serving veterans. So it comes to that education piece, and maybe it's even an intake change or understanding there. There's other surveillance pieces we can do at the local level. So I wish my answer was yes, we know.
The two plans that Liz is talking about, Liz, are Delta Dental has one
Mhm.
and MetLife.
Yeah.
And
Mhm.
what we just found out, we didn't even know it. Our Soldiers, Sailors, and Marine Fund will pay for emergency dental care.
Okay.
Paragraph in there that talks about it. I don't know if that's a national thing that's available nationally, but I know that the Soldiers and Sailors that we administer, that part of that fund, provide oversight. It mentions in there that it is available for emergency dental care.
Okay. All right, great. Thank you. What other questions can we answer? Okay. I'm going to pull us through our closeout and next steps so you all know what action to take next. So I hope you're feeling activated. I also know it's a lot of information to take in, and we are also all very busy. So I'm leaving you with one very concrete, very easy step to take after this session to keep our momentum that we built here today, and that's to share the state profile with one new person or organization. If you're willing, we would love to hear in the chat who you're going to share it with so that we can keep each other engaged and encouraged. In that same vein, we are recording here today, and we will be posting this information to our academy afterwards. So if you have colleagues that you think would be interested, not just in the profile, but in this presentation, it is available for them. Please feel free to share that. We will send out the links so that you can share that with folks. I mentioned that CEUs are available for today's session. Those are hosted on our academy. Shayla's going to post the link for that in the chat. You follow the link, you sign up for the academy, and share your request and your evaluation and get your CEU. Once you're signed up, you can keep all of your CEUs in one easy place that you earn through AIDPH. If you have any questions about that, let us know. Again, all of the data and the reports that we talked about today are available on vetdentaldata.org. We are also going to share a link to Open, And that will have additional details on the Hill Day. So if advocacy is something that you're interested in, I mentioned the training specific to veteran oral health and what we will be asking when we are in DC this spring in May. But we are also talking about Medicaid, and we are talking about access to oral health care for people with disabilities. So even if you're not attending, if advocacy is something you're interested in, those are free and open for you to register for, and I encourage you to take a look and register for those trainings. And I will leave you. Oh, I'm sorry. I'm going to have Shayla post one more link in the chat, and that is our veteran oral health storytelling form. So if you yourself are a veteran, or you know a veteran who wants to share their story about oral health, we invite you to use that form. That's helpful in our advocacy to raise the community voice and share out those first-person experiences as we do things like go to a National Hill Day and share out why veteran oral health access is so important. And with that, I just want to give a big thank you for your time, for your interest in this topic, for being engaged with us here today, and just leave you with the fact that we believe veterans deserve equitable oral health. Okay, I see that we don't have the Hill Day link, but we will post that. We will send that out with an email so folks can access that information. And I hope everyone has a wonderful day, and follow up with any questions that you may have. We are always here. Thank you so much for your time.
Thank you.